What is dementia? Dementia is the name for a group of symptoms that commonly include problems with memory, thinking, problem-solving, language, and perception. In a person with dementia, these symptoms are bad enough to affect daily life. Dementia is not a disease in its own right, and it is not a natural part of aging. Rather, the symptoms of dementia are caused by different diseases that affect the brain, including Alzheimer's disease. Dementia is caused by a loss of nerve cells. It is a progressive condition, meaning that symptoms gradually get worse. This is because when a nerve cell dies, it cannot usually be replaced. As more and more cells die, the brain starts to shrink. This can sometimes be seen in a brain scan of someone with dementia. These scans show a slice through the middle of the brain from the front, like looking through the middle of a stick of rock. They show what happens to the brain of someone with Alzheimer's disease as their dementia progresses over several years. Note how the black areas become larger. This is because the brain tissue, the grey areas, continues to shrink or atrophy as nerve cells die off. Common symptoms of dementia include problems with day-to-day memory, concentrating, organising and planning, as well as difficulties with language and visual perception, and changes in mood. However, each person will experience dementia differently, and the symptoms depend on the areas of the brain that are affected. For example, if cells in the temporal lobes start to die, that person might have difficulties with their language. Nerve cell death in the occipital lobes can cause problems with vision. There is currently no cure for dementia, and many of the diseases that cause it are terminal.